14-year-old girl was brought to the hospital by her mother after vomiting and having a high fever for 2 days. Just a week before, Farah was healthy and active, but her condition became worse and she was weak.
Doctor, my daughter has been vomiting for the whole day and her fever keeps getting worse.
Just speak up. It's probably just a bacterial infection. I will observe her later. Okay, I will check your temperature first. It's quite hot. How much dose should I pour?
Is that the right dose, doctor?
Of course, this will help reduce your fever.
Okay.
Alright, I want you to drink this.
How much now?
A few moments later.
Okay, so your blood pressure is fine. Now I will check your temperature again. Alright, so now your temperature is also normal. Now you can go back home.
Mr. Shana?
Thank you, doctor.
Oh my god, something is wrong with my daughter. Please hurry up.
So, the case raised a very important legal issue in which whether the hospital can be held liable under the medical negligence. There is 4 elements governing the tort of law of negligence, which is first we have duty of care. Duty of care can be defined as an obligation or burden imposed by the law which requires a person to conform to a certain standard of conduct. Second, there has been a breach of that legal duty of care by the defendant, in which the defendant has breached his duty of care. Third, we have causation, in which with or without the plaintiff, whether they will still suffer damages. And lastly, we also have damages, and because of the breach of the duty of the defendant, the plaintiff had suffered damages. Doctors and nurses in the hospital clearly owe a duty of care to their patient, but in Farah's case, there is a delay in the medical diagnosis, causing Farah to suffer a serious brain damage.
After Farah suffered permanent brain damage, her mother brought the case to the court.
Your Lordship, the negligence is the evidence. The delay in proper examination and also the errors from the nurse has caused irreversible brain damage.
And what is the significance of this injury?
The injury is permanent. Now, Farah has lost part of her speech and depending fully to the caregiver. Your Lordship, this position has supported by the established case law. In the case of Pantai Medical Center against Farid Rizal, the patient suffered severe brain damage following to the post-operative care, where the warning signs were not properly attended to. As the result, the victim was left in a permanent vegetative state and depending fully to the medical care.
Alright, continue.
The court in the case held that the permanent brain damage has caused to the serious and irreversible injury, justifying to the substantial damages, including to the long-term care and also loss to the future earnings. Similarly, in the case of Yusnita binti Johari against Dr. Jarali Maryam Kong, the patient suffered brain injury due to the failure to the properly care to her condition and also delayed to the medical intervention. So, the delay has caused the oxygen deprivation to the brain, resulting in permanent neurological damage.
And how did the court view that failure?
Your Lordship, the court found that the negligence directly caused to the irreversible injury and accordingly awarded the extensive damages to reflect the lifelong impact on the plaintiff's quality of life.
So, the injury here is not temporary?
No, Your Lordship. The damage affects Farah for life, so it is depriving her of the full independence and also permanently altering her future.
Negligence is a lifelong cause. Once liability is established, the core objective is to redress the claimant as much money the claimant could make or have if they never had been in the injury. First, we address general damages. These cover physical pain and mental distress, which we call loss of amenity. So what is loss of amenity? Loss of amenity is the loss of ability to enjoy simple pleasure of life. And in Farah's situation, she's not just about a recovery period, but a lifelong and a permanent health issues.
Next are special damages. These are the out-of-pocket expenses incurred from the moment of the incident up until the date of the trial. So now, we are talking about the hospital bills, specialized therapization, and also the intensive rehabilitation required to stabilize her condition. But the most significant burden often lies ahead, future care and dependency. So, because of the severity of the brain injury, Farah will require a lifetime of caregiver support. This includes 24 hours of nursing care, specialized equipment, and also home modification.
Then there is the loss of earning capacity. Even though Farah is a minor and has not even entered a workforce yet, the law recognizes her potential of earn a living has been stripped away. We calculate this based on what she could have achieved if she remained healthy.
This isn't just theoretical. In the landmark case of Takish Ashraf against Government of Malaysia, the court sent a clear message. When a medical negligence results in permanent brain injury, the compensation must reflect the reality of lifelong dependency. The court also awarded substantial sums for future nursing care because a victim should not have to rely on charity for their survival.
In Farah's case, we are not just asking for a payout, we are asking for a lifetime care that ensures her dignity for the next decades of life.
Although the doctor administered the wrong dosage, she acted during the course of employment. Therefore, the hospital is vicariously liable for the negligence of its staff and responsible for paying damages.
In conclusion, medical negligence has been fully established. Farah suffered permanent physical injury due to failure by the hospital staff. So, the hospital should provide adequate compensation covering medical care, treatment and support.
We recommend better hospital protocols, better supervision, and also proper medical checks out to prevent any similar tragedies to happen again. In conclusion, justice in medical negligence is not only a fault, but it's also about fairness and proper compensation.